Are you experiencing serious pain shooting down the arm, possibly accompanied by numbness and tingling, and nothing seems to be helping? Well, sometimes a pinched nerve in the neck is resistant to conservative treatment and just won't let up. So today, we will be discussing other treatment options, including injections and surgery for people with cervical radiculopathy who have not found relief through medications and physical therapy. Hey everybody, welcome back for another episode of Physio Show, where we answer all of your rehab-related questions. For those with severe symptoms who have not responded to a comprehensive physical therapy program and oral pain medication over 6 to 8 weeks, epidural steroid injections might be needed to calm the symptoms down. Sometimes the inflammation surrounding that nerve is just too substantial, and we need a bit of help getting it under control. Injections are an outpatient procedure guided by imaging and physical examination, involving injecting anti-inflammatory medicine under local anesthesia to reduce nerve inflammation. Now, you may experience substantial relief after injections, but don't fall into the trap that many find themselves in after they receive them. Yes, the symptoms will likely feel better. After all, they're injecting a strong anti-inflammatory medicine directly into the inflamed area. But that's treating the symptoms. It's not going to fix the cause or prevent it from reoccurring. Following injections, it is strongly recommended to continue with structured physical therapy consisting of manual therapy and exercises to restore mobility, muscle strength, and control. This way, the nerves are less likely to be irritated with daily activities. It's also a good idea to improve your posture, especially if you're sitting a lot throughout the day, as this can place increased strain on the neck and nerves coming out of them. So after injections, ensure you finish up your treatment and make the appropriate modifications to your day-to-day routine to prevent symptoms from returning. However, in cases where both physical therapy and injections fail to yield results, surgical intervention may be necessary. While surgery can provide substantial relief in the short term, research suggests that its long-term effectiveness compared to non-surgical treatments is not definitive. For this reason, surgery should only be recommended in cases of severe, unresponsive pain or worsening neurologic symptoms in the arms. But before we discuss surgical management, let's discuss pain management. Because the better your pain is managed, whether you have surgery or not, the more tolerant you will be to exercises and daily activities. So check out this link in the description for rehab-related tools to help with pain management. Surgical options for cervical radiculopathy include procedures like discectomy and spinal fusion. Discectomy is a surgical procedure designed to address the root cause of cervical radiculopathy by targeting herniated disc material responsible for compression of the nerve. It is typically recommended for people with cervical radiculopathy caused by a herniated disc, where the inner gel-like material of the disc protrudes and presses against the nerve root. During discectomy, the surgeon makes a small incision in the neck area and carefully removes a portion of the herniated disc that is compressing the nerve. So by directly addressing the source of nerve compression, discectomy aims to alleviate pain, numbness, and tingling associated with cervical radiculopathy. Recovery from discectomy is relatively straightforward, as there is nothing being repaired, so you basically just manage the inflammation of the surgery with a brief period of rest, followed by physical therapy to promote healing and restore neck strength and mobility. On the other hand, spinal fusion is a bit more involved. Spinal fusion is a surgical procedure aimed at enhancing spine stability and reducing movement between vertebrae. Spinal fusion may be recommended for individuals with cervical radiculopathy from spinal stenosis, where the nerve is being pinched due to the collapse of intervertebral discs due to advanced spinal degeneration. During spinal fusion surgery, the surgeon fuses together 2 or more vertebrae using bone grafts or implants. This fusion eliminates movement between the vertebrae, stabilizing the spine and reducing the likelihood of further nerve irritation. Spinal fusion helps alleviate symptoms of cervical radiculopathy by promoting more space for the nerve and improving stability of the spine. On the downside, you are fusing vertebrae, so loss of range of motion is unavoidable, and recovery is much longer, as it takes time for the fusion to take hold, about 6 to 12 months for complete fusion to occur. During this time, rehab is needed to help manage pain, regain mobility, and restore strength and control of the muscles of the neck and upper body. So depending on the specific cause of cervical radiculopathy, it will dictate which procedure is most appropriate. Well, I hope you enjoyed this episode of Physio Show. If you liked the video, don't forget to support us by giving the video a like, and consider subscribing to the channel so you can learn more about your body, how it works, and what it needs to keep moving.